Hello everyone, welcome to Physiology. Today we are gonna see Pigeon chest, which is a next chest wall deformity. So so what is pigeon chest? It's also called as pectus carinatum. So this pectus carinatum is a malformation of the chest characterized by protrusion of the sternum. So in the funnel chest we saw what the sternum will be depressed inside. So here it's a protrusion of the sternum and the ribs. Here what will happen is our cartilage, that is our ribs are attached to the sternum via cartilage. This cartilage will be abnormally grown. So this abnormal growth of this cartilage will cause the sternum to move outside. So it will be pushing the sternum outside. So it, what is the incidence? It's what is the epidemiology is 1 in every 1500, maybe like 1 in every 1500 people may be having this pigeon chest. The incidences, males are affected than females, more than females. So what is the etiology? So rickets, next following an open heart surgery, and then asthma. These three are the etiology. These three may cause the pigeon cyst. And apart from these, the I have said you just now. So abnormally, if the cartilage is growing, then also we can have this pigeon cyst. So next, risk factors: Turner's syndrome, Noonan syndrome, osteogenesis imperfecta, scoliosis, and Sly syndrome. So Turner syndrome, you all know, it's a hereditary disease, hereditary syndrome. And Noonan syndrome, it's a very rare genetic disorder which is present at the time of the birth. It affects the different parts which causes the abnormal development of the baby or different parts. And osteogenesis imperfecta, when the bones are formed, if the bones are not formed properly, then it's called osteogenesis imperfecta. And scoliosis, lateral deviation of the spine causes the scoliosis. This may cause the chest to chest to mold in different way, thus the sternum comes out. Okay, next, Sly syndrome. It is also a rare progressive inborn error of metabolism. So here metabolism will not be perfect and it affects different parts and causes different diseases. One of them is a pigeon chest. So now what are the signs and symptoms? Here, first sign is SOB, shortness of breath, then tenderness or pain in the abnormal cartilage growth. As I've said you, abnormal cartilage growth will be there. There you will be having tenderness or pain. Then recurrent respiratory infections, asthma, fatigue, chest pain, and rapid heart rate. And next, there are two types of pigeon cyst. That is, there are two types of pectus carinatum. That is chondro chondrogladiolar chondrogladiolar pectus carinatum and chondromanubrial pectus carinatum. Chondrogladiolar pectus carinatum is nothing but chicken breast. Here what is happening is our lower breast, that is lower and middle breast, will be pushed forward. But here in chondromanubrial pectus carinatum, it's porter pigeon breast, where the breastbone appears like a Z shape, and here the upper breast is pushed forward, and here this chondrogladiolar pectus carinatum is more common than that of the chondromanubrial pectus carinatum. So both of them are pectus carinatum only. There are two types. Okay. Next, coming to the diagnosis, we'll be examining the chest bone. As I said you, the chest bone might be having Z shape, and also these two things, that the which part of the ribs or the breast is moved forward, because of, by that we can tell that is a pigeon chest. Okay. Then X-ray will go for CT, and in the treatment, as a conservative treatment, we don't have any medicines, so here we are going to give them bracing. So bracing also 8 hours a day, and then we go for surgery. In surgery you have Ravichit procedure and also reverse Nuss procedure. So here if you see a normal transfer section of the chest, it will be like this. But here in the pigeon chest, what I said, the sternum will be moving out, so here all the connective tissue also will be coming out, and the lungs will be expanded abnormally. Okay, this is all about your pigeon chest. If you have any queries, please comment down. Thank you. Please subscribe to my channel.